Welcome everyone to day 3 of our Heart Health Workshop brought to you by SAHHI and South Asian Care. This is the third of a 4-day workshop series where we will explore heart health challenges faced by South Asian communities and ways to prevent them. Today, we'll focus on understanding mental health factors that contribute to increased risk of heart disease in South Asians, and our expert speakers will help us dive into why these disparities exist and what can be done to address them. We're excited to start this important conversation with you and look forward to gaining deeper in the coming days. Now, I'd like to invite our partners from South Asian Care to introduce themselves and share a little about their work.
Thank you, Hiba. Hi, everyone. Thanks so much for joining us and following along. My name is Nisha Tideen, founder and CEO of South Asian Care. As a South Asian woman with a background in health communication and advocacy, I saw firsthand the gaps in culturally responsive care, which led me to create South Asian Care. Our mission is to address cultural barriers, connect our community to compassionate providers, and share trusted, culturally relevant health information. Beyond webinars like this, our website offers a provider directory, educational resources, and tools to support your health journey. Thanks so much for being here. I hope you find today's discussion informative and helpful. Back to you, Hippa.
Thank you so much, Nisha, for your introduction. I want to introduce Sahi on behalf of myself and Sahini Ramaneni. Sahi stands for South Asian Heart Health Initiative, and we are partnering with South Asian Care today. Our mission is to promote preventive heart health in South Asian communities through culturally relevant education. We focus on awareness, advocacy, education, and early intervention. I serve as the Chief Executive Officer and a co-founder of SAHHI. I'm a graduate of Benedictine University, and I'm currently working in health science in Boston, Massachusetts. Sahini Ramineni is the Chief Operations Officer with a Bachelor of Arts in Psychology, who is currently working in general psychology and pursuing a master's in clinical psychology. Our featured speakers and instructors for our sessions are all shown here today, and today we will be hearing from Dr. Vishwani Sahai-Siddiqui and from Kajal Topiwala, who will be our psychiatrist and our yoga breathwork instructor, respectively, for today. This is a little bit of an overview of our session. Our first portion is going to be a mental health talk led by Dr. Sahai-Siddiqui. Our second portion of our session is a breath awareness and meditation session that's led by Kajal Topiwala, and then we'll wrap up and talk about our next steps and our introduction into our final day of our workshop. Before we begin, I want to give a brief background on Dr. Vishwani Sahai-Siddiqui. Vishwani Sahai-Siddiqui is a medical writer and psychiatry trained physician with a commitment to mental health advocacy. She specializes in topics such as hazing, bullying, family dynamics, and cultural stigma, particularly within the South Asian community. Her work appears in publications like Behavioral Health News, and she regularly collaborates with nonprofits to educate the public through webinars and articles. A graduate of psychiatry residency and fellowship program, she now channels her clinical background into clear, compassionate medical communication. She's also a dedicated mother who brings a unique blend of her expertise, empathy, and cultural insight to her work. I'm going to have the South Asian Care team share her presentation, and we can begin shortly.
Thank you. Just pulling that up. All right.
Hello, everyone. Thank you for having me here today. I'm Vishwani. Today I'll be discussing how stress affects the South Asian heart, a mind-body perspective. I am a psychiatrist turned mental health writer and editor, and I am happy to be here today collaborating with SAHHI as well as South Asian Care. Next slide, please. So I kind of wanted to direct these questions to the audience. These would be some questions like, what helps you feel calm? What do you turn to when you feel overwhelmed? And do you think stress can affect the heart, and how? Next slide, please. So common coping styles for stress. So healthy coping is exercise, social support, prayer, and mindfulness. Unhealthy coping is things like substance use, emotional eating, avoidance, self-criticism. How is it linked to heart health? Unhealthy coping can lead to sustained high cortisol, which causes sympathetic overactivation and increases cardiovascular disease risk. So let's explore how this connects with our heart. Next slide. So this is an image of the pathophysiology of stress in the heart. There's a lot of things going on here. However, basically what happens is we have a stressful event in the brain, or there's cumulative chronic stressors that happen day to day or throughout the months and years. And that can either lead to an inflammatory response or an autonomic imbalance. An inflammatory response can activate the coagulation cascade, which increases platelets, causes decreased fibrinolysis, increased leukocyte adhesion, and then it can also affect immune function. It can also affect vascular dysfunction. The other part of it is autonomic imbalance, where it affects the hormones like ACTH, cortisol, epinephrine, cardiometabolic changes, such as increase in diabetes, obesity, hypertension. All of these things, they accumulate and then they cause something called a major cardiovascular event, such as an MI, which we know as a heart attack, angina, heart failure, or sudden death. Next slide, please. Mechanisms and cultural context for South Asians. Just generally speaking, for the most part, there's not a lot of encouragement to exercise or play sports. So a lot of times it can be sedentary behavior. There can be weight gain, metabolic dysregulation. A lot of times there's blue light or evening use of blue light, like using tablets, cell phones, watching TV till late in the night, which disrupts sleep and elevates the cortisol. There can be mental stress, like work or family pressure, which causes sympathetic overactivation. Can also have decreased exercise, not having any self-care. A lot of times in South Asian families, self-care isn't as important as taking care of others. South Asians exhibit increased central adiposity and lower BMI thresholds for diabetes and cardiovascular disease. Next slide, please. So what does the research show about stress in the heart? Chronic stress activates the HPA axis, which elevates cortisol, which we just discussed, which can cause endothelial dysfunction, inflammation, and metabolic changes. Heart disease risk increases 2 to 3 times in those with chronic stresses and anxiety. This can lead to increase in blood pressure, arrhythmias, coronary inflammation, noted in those with chronic psychological distress. So there's a very prominent and somewhat insidious link between stress, mental health, and the heart, although people don't realize this as much as they should, I feel. Next slide, please. Mental health conditions and cardiac risk. So depression can lead to 64% higher risk of developing coronary artery disease. Anxiety disorders can increase heart rate and can also cause poor recovery post-MI. PTSD, 53% higher odds of developing a cardiovascular event. And as we discussed earlier, how does that occur? We talked about in that image that I had just shown a few slides ago. Next slide, please. What is the role and social determinants, in minority stress? What is a minority stress theory? That means like marginalized groups, they face chronic identity-based stress that worsens mental and physical health. So South Asians often face language barriers, conflicts between different generations, immigration-related stress, racial microaggressions, diet that's heavy, oily, unhealthy food choices, enmeshment in the family, lack of boundaries with families, not being able to choose the self over the family. Allostatic load, it increases the burden of chronic stress on the body, and that increases the aging and increases heart disease. Next slide, please. So we're going to talk about, from a cultural lens, what kind of stressors occur in the South Asian community. Next slide. Unique cultural stressors in South Asians. So chronic family pressure and intergenerational expectations, such as succeeding academically, marry within the community, stigma around mental health, which leads to unaddressed anxiety, depression, or other mental health issues, patriarchal family structures, which causes chronic stress in women because of the gender-based roles, conflicts between traditional values and Western norms, which is really common among immigrants or second-generation families, arranged marriage pressures, including emotional strain from mismatched partnerships or family coercion, financial responsibilities toward extended family, which include remittances or dowry-related burdens, social isolation, sometimes for elders or homemakers, and then, as we discussed earlier, dietary practices, which is high in saturated fats, salts, refined carbs, which is often culturally reinforced because people continue to eat the same things as even if they're first generation or second generation. So they're still eating those oily, fatty, carbohydrate rich foods. Next slide, please. What are the other cultural stressors? Pressure to save face or maintain family honor, which leads to emotional suppression. Work-life imbalance, especially among men, expected to be sole breadwinners. Internalized racism or discrimination within and outside of the South Asian community. Lack of open communication about personal stress. Caste or community-based discrimination, sometimes even persisting in other contexts. Stress from visa or immigration uncertainty, especially in the US and the UK. Next slide, please. So there's a lot of gender-based stressors in South Asian households. So particularly for women, some of these I already went over, but here are some to name a few. Pressure to conform to idealized roles of the self-sacrificing daughter, wife, or mother. Limited autonomy in life choices, including career, dress, and social life. Expectations to prioritize marriage and childbearing over education. Judgment and shaming related to fertility, miscarriage, or not having a male child. Domestic responsibilities placed solely on women, even if they work outside the home. Double standards in sexuality, modesty, and freedom compared to male counterparts. In-law and joint family stress, often including covert power dynamics and emotional labor. Underdiagnosis and dismissal of physical health symptoms due to gender bias in care seeking and treatment. Pressure to maintain harmony, even in toxic or abusive marital settings. Stigma around divorce or separation, leading to entrapment in unhealthy relationships. This slide kind of just depicts that as South Asians and like being South Asian women, there's so much work to be done in this community. And clearly there's issues from so many different aspects. Next slide, please. So there was a study that was done on screen time and elevated blood pressure in South Asians. A cross-sectional study of 210 medical students in North India found that those with high screen time, which was greater than 6.5 hours a day, had nearly double the odds of elevated blood pressure regardless of BMI. This suggests prolonged smartphone and device use may contribute to hypertension, a major risk factor for heart disease. Next slide. So this image does show what prolonged cell phone use does on the human body, but we're going to focus primarily on the heart here, where it's showing the erratic variable heart rate and increase in blood pressure. So a study in BMC Public Health found that mobile phone greater than 60 minutes a day, which is about 8 years correlated with 4 to 6 times higher hypertension risk. So if you're using a cell phone an hour a day for over 8 years, it could lead to hypertension. Some data suggests that mobile phone use may reduce stress via social connection. So I guess it depends on how you're using your cell phone or how you're using your tablet. It implies that long-term high screen use is a potential cardiovascular risk, but the context does matter. So if you're using it socially, or are you just using it to scroll and be online for hours without a purpose? Next slide, please. Barriers to mental health support in the South Asian community. So there's stigma, of course. People don't want to seek out help and they're afraid to. Lack of culturally competent care, belief that stress is normal or a sign of not being spiritual enough, Only about 10% of South Asians seek mental health treatment compared to about 25% of the general US population. A lot of other barriers are lack of bilingual therapists, or lack of bilingual mental health providers, fear of community judgment, and misdiagnosis. Next slide, please. So what is mindfulness? There is a science behind mindfulness, and this image just is asking, like, are you mindful? Is your mind always full, or are you mindful, being in the present moment and embracing the present moment, not worrying about the past or the future? Next slide, please. So mindfulness is defined as a non-judgmental, present moment awareness. It's not tied to religion, but there are similar practices in various religious aspects, such as vipassana, namaz, or simran. It helps interrupt stress reactivity and creates a space between the stimulus and the response. Next slide. So the evidence behind mindfulness and heart health is that mindfulness-based stress reduction improves blood pressure, heart rate, cortisol levels, cholesterol, and glucose regulation. The American Heart Association supports meditation as an adjunct tool for reducing cardiovascular risk. Next slide. Mindfulness improves emotional resilience. So they did neuroimaging to check, and people who did practice regular mindfulness had changes in their brain structures, in the prefrontal cortex and the amygdala. It promotes cognitive flexibility and distress tolerance. It reduces rumination, a major factor in depression and heart disease comorbidity. It teaches us to respond instead of react. Next slide. So there are a lot of tools online that we can use to practice mindfulness, but these are just some that are free. One is called Calm. Another one is called Headspace. I've used both of these. They're both very good. There's a couple of more called Insight Timer, 10% Happier, and it looks like a repeated Headspace, but these are all really good apps to help with mindfulness meditation. Next slide. Simple daily mindfulness practices. So anchoring to breathe, even 2 to 3 minutes reduces reactivity. Mindful transition, pausing before meals or meetings, mindful walking, hand on heart breathing, culturally affirming ideas like gratitude at prayer time, mindful chai making, or reflective journaling. And then other things are when you're listening to someone, mindfully listen, wind down and fall asleep, walking meditation. There's just many different ways we can be mindful. Next slide. Grounding techniques for acute stress. So this is the 5, 4, 3, 2, 1. 5 things you can see. So you would name it. 5 things you can see, 4 things you can feel, 3 things you can hear, 2 things you can smell, and 1 thing you can taste. Engage 5 senses to come back to the present. Tapping and self-compassion touch. Use in traffic, before medical visits, or in conflict. Building a sustainable practice. So start small, 2 minutes a day, that helps with consistency. Stack your habits, tie it to something else, something that you do daily, like brushing your teeth or prayer. Use culturally inclusive apps. There's so many, like one is called Sukoon, one is called Sahaj Yoga. There's a lot of YouTube guided sessions. And then there's really no wrong way to do this. So if you continue to be consistent, it should be very helpful. So what we learned today is that stress has real and physiological consequences. Our community faces unique stressors, which are often hidden and insidious. And mindfulness is scientifically validated and culturally adaptable. And evidence shows that small daily shifts can protect your heart and mind. Just something to think about. What is one small thing you'll try this week to reduce stress? And I am on LinkedIn. I would love to connect with you. You can also reach out to me on my email. And if anyone has any questions, I'd be happy to answer those now.
Dr. Sahai-Siddiqui, we actually have a question from
Yes,
an external user who
yes.
is asking how to integrate these mindfulness techniques and these grounding techniques across different generations of families or across parents, grandparents, and to integrate it into more of like a household dynamic.
Yeah, that's a really good question. I think I think it's really, really important to kind of explain to, if it's parents or grandparents, explain to them the benefit of mindfulness and also maybe kind of pull in some religious, like spiritual techniques along with it because that gives them some incentive. I feel like a lot of first generation families, they have parents and grandparents who are probably very religious or spiritual, and just tying it with spirituality really helps to incorporate that into daily life.
Right, that makes sense. Thank you so much for your insight and thank you for taking the time to be able to speak with us today and to be able
Of
to
course.
obviously speak to